Welcome to Omaha Mom Talks. I'm your host, Jessica Terrace, and I'm so happy that you're joining us today. Today on this episode of Omaha Mom Talks, we are going to be chatting with Rachel Brabec, a local mom in Omaha, mental health therapist, and she's going to be chatting with us about the topic of perinatal mental health. Rachel Brabec is not only my close and personal friend, but she is a licensed independent mental health practitioner, LIMHP, who is certified in perinatal mental health through the Postpartum Support International, and she has advanced clinical trainings from Kleiman, who is a guru in our industry of perinatal mental health at the Postpartum Support Stress Center. If you are somebody who is pregnant or expecting, this episode is for you. We're going to chat all about the chaos that comes along with the joys of postpartum, what to expect, how to get help, and if you are a lover of moms, how you can help get them connected with the right support. As a reminder, this podcast is not a substitute for mental health counseling or medical advice. If you are in need of support, please reach out to a provider or a mental health therapist. Let's get into it. Okay, welcome Rachel Brabec to Omaha Mom Talks. We are so excited to have you join us and have this very important conversation about perinatal mental health. And we'd love to hear a little bit about just the wisdom and guidance that you give to the moms that you support. Rachel is a dear friend of mine. She's extremely smart and compassionate. And so I'm so excited to share her with all of you today. So Rachel, I would love for you just to share with our listeners a little bit about you, the work that you do, and any parts of your identity that you feel are important.
Absolutely. Okay. So I've been in Omaha now for about 16 years, but I'm actually originally from Cheyenne, Wyoming, and moved to Nebraska to attend University of Nebraska at Kearney. Yep. And studied criminal justice, and had the opportunity after completing that degree to work at the Kearney Police Department's Victim Witness Unit while doing my master's in community counseling. And so after I completed that, I got to move to Omaha and met my husband shortly thereafter of 15 years. I don't even know how that goes.
I was there the night we met.
I don't know how that even happens. 15 years. And we have 3 children, 11, 10, and 7. And I spent 11 years working in the psychiatric residential treatment level of care before starting private practice, where I've been for the past about 6 years, really focusing on and spending a lot of time with women in their journey. But a really important part of where I'm at today is because of the Postpartum Stress Center. And I want to mention them, Hillary Waller and Karen Kleiman. They're are incredible, and their contributions to maternal mental health will be embedded in everything I contribute today.
Yeah. Awesome. Wonderful. So you live here in Omaha, you have a private practice supporting women, and I always love it when I'm listening to a podcast and they share a little bit about how the guest and host know one another. Okay. And since we have such a special, close, unique friendship and relationship, I want to share with our listeners just kind of how we met and how we continue to stay connected.
Love it.
So feel free to jump in at any time. Rachel and I met, I won't say when, but we met when I was a freshman at the University of Nebraska at Kearney, UNK. Rachel was a sophomore, and we actually met like right away. I went through recruitment or rush, and we joined the same sorority. Rachel was already in the sorority that I joined.
You always point out I'm older.
I know. And just by a year. And so I really, we became fast friends. I am really grateful for Rachel. She really was like a step-in big sister to me. For those that have had like difficulty with the adjustment to college, it's a lot. It's a big adjustment with being a young adult, trying to be responsible, figure out your schedule, friendships, navigating new things, new people. And so I was really fortunate that I had you to where you kind of already had an idea and lay of the land and just kind of took me under your wing. And so that is how we met and how we started as friends. We later both landed in Omaha, just like individually and at different times, and both had gone to graduate school, separate schools, and gotten our degrees in counseling and clinical social work, and then continued to be friends and later landed as coworkers at a psychiatric residential treatment facility. And so if you have ever worked like a stressful job such as that, or, you know, for the teachers or doctors or nurses, you know how important having a work bestie is, somebody who just gets it, gets you, supports you. And so we were really fortunate that we had that like pre-existing friendship, but we literally ate lunch together every single day. And we were like so protective of that time together. Sometimes like other coworkers would join us for lunch or invite us to lunch, and we would, but then we were like, because that was like our solid hour.
We still had to get that time
to
in.
like vent about life, work, all of the things. And so, we, you know, again, continued to just be really close through that experience. And then we later both, went into private practice, opening our own businesses in mental health. Again, did that separately at separate times, but definitely like supported one another. And then we both went and got our advanced clinical training in perinatal mental health through Postpartum Support International together. We did do that together. We were like, I was like very new mama. This was in 2019, and I had my baby in 2018. You had 2 babies at that time, right? And we were or did you have 3?
I have no idea.
Okay.
I couldn't
You
tell
had
you.
2 or 3.
I don't know.
And so
I have 3 now. I know that much.
We were like in the thick of it, and we were both mental health therapists, and we had both had our own struggles and with perinatal mental health. So we were like, listen, we need advanced knowledge and training and skills to support these mamas. And so we did that in 2019. And even after we were, you know, done with our advanced clinical training in that specialty, we were like both dying to learn more, gain more. And so we've both like sought out additional trainings together or shared trainings and knowledge. And Rachel actually helped founded a perinatal consultation group. We kind of started that together, but you really like have led it. And so I'm so grateful for that. It's a group of other professionals in Omaha that are supporting women in the postpartum period. So we have therapists, doulas, some reproductive prescribers, APRNs, and medical social worker, where we all get together and like staff cases, share resources, give clinical expertise. And that's really beneficial if you're in private practice and you're working solo. So I'm really grateful for your leadership in that.
It has been wonderful. And as you're talking, I'm thinking about that idea of us craving more information. And I really think it's that idea that no one's talking about it. That we were both really, you know, trained in counseling and mental health, and we were experiencing these symptoms postpartum that were like not talked about. And I think that was a really big driving force in thinking, we need to know more about this. We need to figure out what's going on and be able to acknowledge this experience.
Absolutely.
For other women.
Yep. And that is like part of this podcast at Omaha Mom Talks, and part of this discussion today is just bringing to light and surface a lot of these conversations that maybe are talked about like in whisper, but we're just like shouting it out from the rooftops, normalizing it, talking about people's stories, our own stories. And I shared a little bit about my postpartum story on the last episode, which is, like you mentioned, as a trained therapist, I thought like, oh, I've got this. I know the symptoms. I know the signs. I wasn't yet working with moms, but I thought, you know, I knew the sign, and I didn't. And like when you are in it, it's really hard to know you're in it.
Absolutely.
And so that's why talking about it and knowing the signs and the symptoms before, like if you're pregnant or expecting, if you can have that information, or your loved ones can have that information, we can help get you connected to the support when you need it the most.
Absolutely.
So Rachel, I would love it if you would just share, you shared a little bit about yourself and your kids, but just a little bit more about like your postpartum journey, and then anything that, you know, maybe led you to getting the specialization in perinatal mental health.
So my postpartum journey is a wild ride, and I do love talking about it because I think there's so much in it. I want to acknowledge that we won't have time or capacity today to talk about a lot of really important things in pregnancy, postpartum. There are a lot of things we aren't going to get to, but I want to acknowledge all mamas' stories and that we are leaving really big things out. And
today is like a perinatal mental health 101 intro, because we could talk for years about
Absolutely.
all of the things that come along with postpartum.
You could, do episode and then episodes and more. Okay, so I love the perinatal population. I feel very maternal towards this population.
Yeah.
And some of that comes from this reflection that I had, and puzzle pieces kind of came into place in reflecting years after postpartum. When you are in it, it's really hard to see that you're suffering. And so when I think about postpartum, one of the snapshots from my experience, I can go back and see myself in our home at the time, and my husband was back to work, and I'm holding this little baby newborn, and I'm standing in my kitchen, I'm just sobbing. Yeah. And I was so overwhelmed. And I felt this devastating pressure because I saw the countertops in my kitchen and they were pointed at the corner. And I thought, this is such a risk. How would someone create countertops that are pointed? And I'm carrying this little baby.
Yeah.
And if I'm not a good enough mom, I'm going to hit my baby's head and I'm going to hurt my baby and it's going to be catastrophic. The weight of that idea was paralyzing. I felt like now I'm a mom and I have to keep this child safe from the whole wide world. And the risk is right here in my own kitchen. Like, how am I going to do this? And that was just one example, right? Of these really disproportionate thoughts that were happening, where then I was losing sleep because I'm up Googling, right? I want to know how to childproof the whole entire world. And I'm not trusting myself to do or know the things that I need to do. And that anxiety is something that I really go back to, right? Like I was really suffering. My ability to function was impaired because of these thoughts I was having.
Right. And I think just for those that are listening, to add the distinction, so having worry or like the urge to protect and keep your baby safe is all very common and to be expected. But when I hear you say like the weight of it was paralyzing, that's where when I'm meeting with a client, my ears perk up and I'm like, okay, this is impacting her ability to be present for other things. She can't shrug it aside. She can't get it out of her head. And it's impacting like everything that she's doing. It's impacting her sleep, what she's doing for the day, things like that. And so we'll chat a little bit more about like what's common and to be expected. But I just wanted to point out like your words of saying like the weight of that was paralyzing.
Yes.
Like that is when we are talking about postpartum anxiety.
That's right. Yeah. We're really looking at the distress that comes with the thought. We know that scary thoughts are going to happen. Yes. Moms have scary thoughts. It's that idea of how it was affecting me and the distress that it was bringing.
Yes.
The idea that was really disproportionate, right? It was disordered. It was out of order for what we would expect a response to be on a pointy countertop.
Right.
Right? That kind of cues us into, okay, wow, like this is really scary for you.
This is very severe. Yeah.
Okay, so I was working through a lot of those thoughts, right? A lot of those worries. And then 3 weeks, when our baby was 3 weeks old, I tore a meniscus in my knee. And
I remember that.
Yes. And we
were coworkers, but you were on leave.
I was on leave and it was just this random thing. And I go back to is my husband wheeling me in this wheelchair, right, up to the ortho doctor. And I have the infant car seat, right, this big heavy on my lap, and baby in the car seat, and I'm in the wheelchair, and we're like laughing, right, because you're at this point where it's just the ridiculousness of it all. And I'm 3 weeks postpartum.
He's trying to care for you. You're trying to care for baby. He's like, what are we doing?
And we end up needing surgery. They have to go in and repair this meniscus. And if you've ever had a repair, they immobilize your leg for 6 weeks.
Okay.
And so I'm in a full leg brace, 3 weeks postpartum.
I remember you lived in a house with stairs.
Absolutely.
So I'm laughing just thinking of the absurdity of like you crawling up and down those stairs with a baby?
With a baby, right? Your husband, he's back to work. He's trying to like bring meals and get things set up. And we have wonderful friends and family that were doing everything they could. But the reality of it, in my mind, was that what was needed for me and then what was needed from me was really polarized.
Yeah.
Right. And the mother I wanted to be, I really desperately wanted to be. And the mother that I could be was really different.
Yeah.
And the weight of that thought added with the anxiety was really difficult. It was really distressing. I was really suffering in the way I was feeling about failing as a mom.
I think what you said there, like I can definitely relate to, and I think so many other moms that I meet with can relate to, which is like this belief of a good mother or an ideal mother, or these expectations that we put on ourselves as a mom, you know, as we're pregnant and as we're dreaming and, you know, getting excited. And then when we're faced with the reality, and it's such a contrast, such a polarized difference, as you mentioned, it can feel like, then there's something wrong with me.
Absolutely. Why am I not a good mom?
And we know that is not true.
Correct.
Yeah. We know that, well, there's a lot of truths there, but one being that you are human, dealing with human hardships that would be distressing for any human being.
Yes.
Not to mention you're in a very sensitive, critical period of time with adjusting to just birthing a human.
This is brand new.
Yeah.
Right? And if it's your first or even your second, all babies are different. You've never done this before with this human.
With this baby. Yeah.
Yeah.
Yeah, absolutely.
Yeah.
So you have this surgery.
So we have the surgery. I do the physical therapy. I get back to work 12 weeks, right? 12 weeks and women are ready to go. I'm back to work.
Oh yeah. I remember.
Yes.
When you came back.
Sobbing.
Yes.
I'm a mess. I'm not sleeping. I'm up Googling.
You're separated from baby.
I'm worried about baby at daycare. I'm separated from him. It's just this really overwhelming experience. And so I start in the mornings, I'm sick, right? I'm getting sick in the mornings. I'm really fatigued. I'm not feeling like myself. And my breastfeeding supply, which breastfeeding, whole other episode.
Yeah.
Whole other episode.
I touched on that too last week.
Okay.
So hard.
Yes. So hard. It's really decreasing, right? I'm not getting enough. And I start panicking. I'm thinking, oh my gosh, this is unsustainable. So I go to the doctor, right? I'm thinking, something's not right. And, you know, twist in the plot, I was pregnant.
Pregnant again.
I was pregnant. I was
12 weeks postpartum.
a little over 12 weeks postpartum, and I was 6 weeks pregnant. I'll tell you how that happened in a different episode.
Luke, I'm going to have to talk
I know.
to you.
I'll tell you about how that happened in a different episode. You know, and I point this out just because here is, you know, when I reflect back on this experience, that postpartum mom that had just returned to work was totally abandoned. Right? And here was the 6-week pregnant mom.
Yeah.
And those things couldn't exist together for me. I couldn't make that make sense.
Right.
And so, of course, you know, you do the best you can with what you have. But all of that to say, it's complicated.
So complicated.
Our postpartum journeys can be really complicated.
And I know, well, just from knowing you, but from, you know, being a mom myself and working with moms, that those are just a few of the hardships, right, that are coming to mind that you're sharing today.
Absolutely.
But that is mixed with all of the day-to-day responsibilities, stressors, learning new things, sleep schedules, figuring out, your breastfeeding supply journey, how to feed baby, how to soothe baby. I mean, it is so much that we can expect that it's common to feel stress and to feel worried. This is like a total life-changing experience to bring a human into your world. And a lot of those things are common and to be expected. But what I want to chat more about today is like, when do we know that this is becoming, more than mom should handle on her own, that she's needing some additional support, and what are some of the things that we look for? So let's kind of chat a little bit together about perinatal mental health. Again, this is just a little bit of like a 101 of some of the conditions that can happen during conception and postpartum. So jumping into this chat about perinatal mental health, I just want to, mention, so perinatal mental health is a term that I use a lot, but we hear a lot of different terms in this world. So you might hear like maternal mental health, perinatal mental health, postpartum, and really like all of those terms, PMADs, which is an acronym that stands for perinatal mood and anxiety disorders. I use them pretty interchangeably, and I don't care what people use when they come to my office and meet with me. But a lot of times I just say either PMADs or perinatal. What terms do you use?
Same. Yep. Yeah. I use a lot of maternal mental health and perinatal mental health.
Yeah.
Yep.
Yeah. So you'll hear us use all those terms, but they're just kind of meaning the same thing. Yeah. So because lately I have been hearing like PMADs used a lot, and especially like on social media, let's like break down like what that acronym means if you feel comfortable. And then we can chat about some of the like clinical diagnoses that we see that fall under the umbrella term of perinatal mood and anxiety disorders.
Yeah.
Sound good?
Of course. So the P in PMAD stands for perinatal, right? And that's going to be from the time of conception through the first year postpartum. It encompasses that full time span. And then the M is going to be for mood. And in that, we're really looking at depression, bipolar disorders, and psychosis, which could happen in that perinatal period. The A stands for anxiety, and that kind of encompasses generalized anxiety disorder, obsessive compulsive disorder, post-traumatic stress disorder. There are a lot of different disorders in that. And then, of course, disorder is this idea that it's causing us impairment. There's distress associated. The way we're feeling is out of order in what we could reasonably expect you to feel in this situation.
Yeah. So really focusing on that level of distress. So like in clinical terms, we always look at the intensity. So like how strong is it? Yeah. We talk about the frequency. So like for some folks, and we'll talk maybe in a minute about like baby blues, but it's like, oh, I had, these moments of tearfulness or sadness or feeling, shame and guilt, but then it kind of passed and then I went about my day. So that isn't as frequent. If I'm looking for more of like a clinical diagnosis, it's like a large portion of that mama's day.
Yes.
And then we're looking at duration. So the timeline. So we'll talk in a moment, I think, about like baby blues. And so that usually is something that we look at clinically after like 2 or 3 weeks. It's kind of passed, or, that mama's been able to find some support and is feeling more regulated and like herself. If it goes past that 2 to 3 weeks, that's when we kind of want to look at and assess that duration period, that time frame of, could this be a postpartum depression or anxiety or something like that, and look for the assessment. So let's go ahead and chat a little bit about, more specifically about some of those disorders under PMAD. So I think, I'm very glad that more people are talking about like postpartum depression. I feel like that's something that people have heard or are familiar with that term, or sometimes we'll just hear people say like she has postpartum, right? Which again, I don't really care what terms people are using when they're coming to my office. I just want them to come and we're going to assess their needs and what's going on and figure out a plan to get them feeling better together. So, what I think that there are some like stigmas out there. So a lot of times we'll see like the really extreme cases on the news, which really generally a lot of the things that we see in the news are like postpartum psychoses. Right. So that's when a mom is having a break from reality, seeing things or hearing things that are not real. That is considered a medical emergency that needs immediate medical attention. But those are the things that we hear on the news a lot, where maybe mom like harmed baby or hurt herself or something like that. And the reason why I just want to point that out is that it doesn't have to be that extreme for you to get help.
That's right.
Those mamas deserve help. And again, that's a medical emergency. But there's a lot of other symptoms that come along with postpartum distress that I want to chat about today that deserve our attention. So let's start with just kind of talking about what is baby blues and what is postpartum depression, and like how are those things different?
Yeah. What you said, that this idea that we know 1 in 5 women and 1 in 10 men experience a postpartum mood or anxiety disorder. Right. And when we look at psychosis, that idea of potentially hurting baby, we're looking at 1 or maybe 2 in 1,000.
Much more rare.
Much more rare, right? And so when we look at 1 in 5, we know a lot of women are experiencing this. A lot of men are experiencing this too.
And I think that's important to highlight. And the non-birthing partner can also experience postpartum depression, anxiety. So that could be an adoptive parent. That could be a dad. That could be a same-sex partner. The non-birthing parent, absolutely. It's an adjustment.
It's a huge adjustment. When we look at baby blues, so when we come into baby blues, this is a series of symptoms that usually start about 2 to 3 days postpartum or after baby arrives and peak at day 7. They usually last between 2 and 3 weeks. There's biological reasons for this with hormone changes.
Abrupt hormone changes.
Absolutely. And if you're trying to breastfeed, there's hormones going on there too. There's so much happening. We expect this to be a transition. Yes. We expect there to be tearful, crying spells, some
crying
anxiety.
For no reason.
Absolutely. We expect you to be irritable, a little bit on edge, really trying to get an idea or an understanding. Your whole routine is off. Right? Everything that you've known and have been doing has changed. And so we know that transition is going to cause you to kind of feel differently.
Absolutely.
Typically, there's not significant distress with baby blues. We're not looking at your ability to care for yourself or baby impacted by the way that you feel. And this is kind of waxing and waning. You have moments or snapshots during your day where you feel okay, you feel like yourself.
Yeah. Can you talk? So I remember before I was a mom, I always heard that term waxing and waning.
Yeah.
And I was like, what the heck does that mean? And so you kind of described it, but just maybe.
Yeah, just kind of that back and forth where you're in it and then you're out of it.
It's like I'm feeling the distress and overwhelm,
Yep.
but then I'm having moments of happiness and
absolutely
joy, and I'm taking care of myself and taking care of baby. It's not impacting my ability to do my
And you're really able to kind of see that you are struggling. You're able to kind of stand back from it and say, ooh, that was weird. I was just crying.
Yeah.
Where when you're in it, there is authentic suffering. You are really in it.
Yeah.
And sometimes it feels so heavy because you're really scared it's not going to change. Mm-hmm. You're really scared that that's motherhood.
Yeah. Yeah. I hear so many moms say that. Like, is this just the way that it's going to be?
This is what I'm going to do forever. And it's like, no, this is not motherhood.
We were talking about baby blues. Okay. So I have a memory that I want to share when I had given birth to my firstborn, and I was like, just like a few days postpartum or home, and you dropped off some food. And I think you had like your kids in the car. So you were literally just like dropping off, like such a good, loving friend. And I answered the door. And the minute I saw you and you're like my friend and my safe person, I started bawling. Nothing was wrong, right? Like, other than I just went through this huge birthing experience, and I have this new human and this new identity, and I'm not sleeping and I'm not producing enough milk, and I see my friend and I'm like, ah, and you were like hugging me, and it was cold out. So we were like on the porch, and you're like, I get it. I know, it's okay. And just that little love and reassurance and like moment for me to be able to cry felt so good and so comforting. So I don't even know if you remember that moment.
No, I remember knowing that I was feeling so maternal towards you.
Yeah.
I remember that feeling, that inclination to reach out, you know.
Yeah, and I
to several, right? And now, of course, created a whole practice doing that, but it felt so important to reach out and to ask if you were okay.
Yeah.
To see you, to put a face in your doorway, because I think sometimes we miss that. Mm-hmm. We miss it because we're not asking, or we're not 100%. Looking and really seeing.
How many people are asking about baby?
Yes.
Right? Which, as you should, you just give birth as human. But
absolutely.
Like, it's so, how's baby? How's baby sleeping? Da, 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 da. But you're so right. Like, we're missing the opportunity to ask mom, like, how are you?
Yeah, we're missing what she's not telling us, right? Mm-hmm. Where we text and say, how are you doing? And it's good. I'm tired. But what is she not saying? And if we're not standing in front of or seeing that mama, we're missing so much of what she needs to tell us.
Yes, absolutely. Mm-hmm. That reminds me of when I meet with a new mom for an intake therapy session, I always make sure and ask, you know, is there kind of anything that I didn't ask you today that you're hoping to share with me? And then they might have, you know, things they want to share. And then I ask them, is there anything that you're scared or worried to tell me?
Absolutely.
That you're worried that I might think differently of you, because again, good moms have scary thoughts.
They do.
And you want to give a plug to one of our favorite books. So this book is called Good Moms Have Scary Thoughts.
Yes.
By Kleiman, who's Rachel's mentor, guru, adopted mother.
Yes.
She's like a perinatal mental health guru who founded the
Postpartum Stress Center. Yes. And has really been cultivated so much research and community and opportunities for
and this
support.
book is one I will say that's good for every mama. I keep them at my office. My moms that come in read it, share it, take it home, and then now like they are gifting it to each other.
I love that.
Yeah.
I wish every mom would get this in the hospital.
I do too.
Before she leaves, she watches the video on car seats and don't shake the baby, and she gets...
Yeah. So, and it's like an illustrated book, like comics kind of. So it's not like clinical or hard to read. And it just goes through a lot of the really common chatter that moms have in their heads.
Yes.
That are normal and common, and brings light to those things, and then gives some ideas and strategies on how to bring those things to surface, how to talk with a trusted person, et cetera. So Karen's also wrote a lot of other great books, a lot that are great for clinicians. So if you're interested in perinatal mental health and you're a therapist, she has a lot of great resources and books.
Amazing.
So let's see. So we're talking about baby blues.
Okay.
And I know we got a little off track, which is fine. And then tell us how that's different from postpartum depression or PPD, and like how those symptoms look different.
Absolutely. So we're going to look back at that distress, right? And so in postpartum depression, we're looking at about 10 to 15% of new moms. And we're really looking at mom's ability to function being impaired by the way she's feeling. So you're not sleeping, you don't have an appetite, you're feeling really agitated, you're quick to snap at your partner. You could be really tuned into or overwhelmed by loud noises, overstimulation. This idea that you feel like maybe you made a mistake, or I'm not a good mom.
Why did I do this? I hear mom say.
Absolutely.
I wasn't cut out for this.
This isn't what I expected.
Yeah, this isn't what I expected.
And a lot of shame and guilt associated with those thoughts of, this is motherhood and I don't want to do it.
Yeah.
This is really hard. It's not what I expected. And so in that depression, we're looking at mom's ability to function being impaired in a way where others are recognizing, or she's not able to kind of care for the baby as she wished she could. And sometimes this also comes with suicidal ideation.
Yeah.
Either passive, where it's this idea of I could go to sleep and not wake up and that would be okay.
Yeah. So I think that's important. I hear a lot of passive with a lot of folks that I meet with. And those are things that a lot of moms are scared to tell me, because they're scared. Do you think you're going to take baby away from me? What does this mean? And so I'll hear moms say things like, I wish I could just go for a drive and like not come back. So those are passive, essentially what that is. When I hear someone say that is like, I'm so stressed that I want to escape all this hard stuff that's going on. Not that I don't want to be alive or that I don't, want to be on this earth. It's just like, this shit is hard.
It's so hard.
And I
feel like a burden to others, right? I had this baby and now everybody's having to help me with baby, and I'm such a burden, and everybody would be better off without me. And it'd be fine if I didn't wake up. Yeah.
So that's a little bit about passive.
Yeah, that
suicidal.
passive suicide or active suicide ideation is when you really are thinking of a plan, or you feel like, life would be better with you not being here.
Yeah, and have ideas on how
These are important things to talk to someone about.
Absolutely.
These are scary thoughts, but these are thoughts that women have, and it's so important to talk about it.
Yes. With postpartum depression, I feel like, again, as we're talking about those symptoms, I want to make it clear to those that are listening that this isn't a checklist that you have to meet 1 through 10. And yes, I have this. You might just be experiencing a couple of these symptoms. You don't have to have certainty that you have this diagnosis or any diagnosis to reach out for help. If you are feeling, if you even just have a little inclination of something's not right here. Yeah. Or if somebody that loves you is saying I think you deserve help. Or I think we should talk to somebody. Those are not an attack against your value or your worth or goodness of a mother. Yeah. You're a human that's going through a really hard, intense adjustment, and you deserve to talk to somebody about it.
Absolutely. If you're not feeling like yourself, right? Yeah. This idea that you're not quite feeling like yourself. I see a lot of women with baby blues. I see a lot of women with what we call postpartum stress syndrome, where it's like an adjustment disorder. They're feeling just really stressed. They don't meet diagnostic criteria for any mental health diagnosis.
It's that support.
And it's still hard. It's so hard.
It feels hard because it is hard.
It's hard. Yep. And you deserve that support.
Yep. So that's a little bit about baby blues and postpartum depression. In a minute, I will talk about like how to get help and when to seek help. But before we do, let's chat. In that PMADs acronym, we have the anxiety, the A. So let's talk a little bit about like what's under that anxiety A, like what are some of the disorders, and then like what are you seeing commonly and what are some of the symptoms?
Sure. So quickly touching on perinatal obsessive compulsive disorder, someone I might see in my office could present with this thought that's really distressing, right? It kind of starts with this thought, this idea, and maybe someone comes in and they're thinking something bad's going to happen at night. I just know something bad's going to happen at night, and it causes a lot of distress. And to help them kind of cope or relieve that stress, they come up with a very rigid ritual, something that they're going to do that's going to help make this thought feel better.
Yeah.
Right. And so they might be unlocking the doors and then relocking the doors and plugging things in and then unplugging them. And they might be turning on certain lights and turning off certain lights and moving furniture. And now I can go to bed because I've done the thing. And we go to bed and we lay our head down, and here comes that thought. Something bad's going to happen tonight. And the only way I'm going to relieve that stress and the distress from the thought is to do that thing. And so I get back up, right? And so it's this idea that we have this intrusive thought or image or idea that's really distressing, and that we have a compulsion to do something, to act in a way, and this can even be a mental compulsion, right? Something we're doing mentally to relieve the distress from the thought or the image. This is spiraling, right? Because the ritual, the thing that we're doing, never relieves the thought.
Right. It's a very short-term
It's a very short-term relief.
And then it comes the obsession or the thought or the image comes back. I think one thing I always like to point out with perinatal OCD is that the thought, which we call an obsession, is distressing to the mom. It's upsetting. So some of those thoughts, a person who's not trained in this may hear and be like, that is so disturbing. There's something wrong with this person. Because some of those images could be like hurting their baby in some way, but it's distressing to them. And so I usually tell moms, if you're having the thought and it's upsetting to you, I'm not worried that you're going to do it. We're still going to chat about how to keep you safe and how to keep baby safe. But the fact that it is like so upsetting to you and you're essentially telling me like you have shame and guilt surrounding it. I mean, this is an intrusive thought. This is an unhelpful thought. This is not something that is congruent with you or who you are or how you show up in the world.
Yeah, I always say this is not you. This is a symptom.
Yes.
This is a symptom. This is not you.
Yes.
So that's a little snapshot OCD. When we're looking at post-traumatic stress disorder in the perinatal period of time, a mom that I might see may have traumatic labor or delivery, right? Have a really bad experience in the hospital, and then have difficulty looking at pictures of the delivery, talking about the delivery, being really overcome with emotion, feeling like she has flashbacks or hypervigilance. She might also be avoiding driving by the hospital, may not be able to attend follow-up appointments. And so that really big avoidance was something that feels really traumatic.
Yes.
That is really traumatic.
Absolutely. And deserves your attention.
Absolutely.
With postpartum PTSD, I always tell mamas, or I see what's very common is people are like, aren't you so glad baby's here? You have a healthy baby. All these things are telling you to be joyful. But I just went through this really traumatic, awful thing, and that deserves your attention. Let's share a little bit about postpartum anxiety. I feel like that's something we see a lot as well.
It is. This is 1 in 5, right? 1 in 5 women report this. Anxiety, we all kind of know that busy energy of anxiety. We have those, again, irritability, low tolerance. In this, there's this really big need for control. And so when we're experiencing anxiety, a lot of kind of how I explained in my postpartum experience earlier, these are hallmarks. We're missing sleep. We're having intrusive thoughts. We're feeling paralyzed by the thoughts. We're not able to care for baby maybe in the way that we want to because we're so consumed by these ideas. We're trying to control a lot of what's happening externally because we're feeling really out of control internally. Another big part of this is that we tend to sometimes push away or repel support because we're afraid of losing control. We're afraid somebody's going to help in a way that doesn't feel good.
Ding, ding, ding.
And then we can't take it back. Right? We can't take it back. And so people are offering to help and we're saying, no, I'm good. And
can't possibly trust you to do it
when you're not going to do it the right way.
Do it the right way.
Right. And so we're avoiding those things. I want to validate mamas. Here's the holidays, right? I want to validate mamas that aren't taking baby to family Christmas with 50 people that have flown in from 5 states that all want to see baby, and we're in cold and RSV, and right, that's not what we're talking about. No, we're not talking about repelling. We're talking about this idea that I'm not going to let in my closest support system because I'm really scared. Yeah. And I'm suffering, and I won't let someone help because I don't know that it's safe.
Right, right. And I think that part of that suffering that I think is really important for us to talk about is that so many are suffering in silence because there's just so much shame attached to it, so much guilt. Do you feel like it is overlooked or flies under the radar a lot?
I do think it's overlooked, specifically anxiety, because over-functioning is, unknowingly reinforced. When we show up to our, postpartum friend's house and we're bringing them, lasagna, and they are up and their hair and makeup is done and their house is spotless and there's muffins on the counter that she made, and baby is sleeping soundlessly because he's been up all night, and we tend to say,
she's doing great.
Oh my God, you're doing great.
You're a super mom.
You're rocking it, right? And what we should be doing is we should be,
my ears ring, right? Like
looking at that mom and saying, are you okay? What?
Yeah, that's that, like overcompensating, right? That control. Yes. If I can control all these external things, then I must be doing okay. I'm okay. Yeah, absolutely. I think just such an important reminder is that we don't have to suffer in silence.
Correct.
One of the things that I always mention to new mamas is that these postpartum concerns are very treatable.
Yes.
With the right help and with the right support. You will be well again. That's one of the things we always say at Postpartum Support International, PSI. And so one of the myths that I hear a lot with moms is that good moms don't need help. And I happily love to debunk that myth, which is that good moms know that taking care of yourself is taking care of baby and taking care of your family. So I want to talk about how people can seek support. One of the things that if anybody is listening, and you are either wondering if there's something going on with you or if you're worried about someone that you love, I want you to know that you're not alone. Help is available. So let's chat a little bit about ways that you can manage postpartum help and how to seek help. Let's chat through that.
Yeah. So support is the remedy for, it falls into every single one of the things we've talked about. It's support in any capacity. You say yes. You say yes to the support that feels good. We're looking at really reaching out to people that have helped you in the past and utilizing those resources in preparation for postpartum, talking about it.
Yeah.
Karen Kleiman has, she went viral with hashtag Speak the Secret. And it's about talking about your experience.
Yes.
And it opens that pathway for others to talk with you.
Yes.
You can reach out, follow Postpartum Support International. You can follow the Postpartum Stress Center. These are wonderful resources. PSI has tons of online groups.
Yes. So reaching out for support. So I heard you say that's one of the most important things. And you certainly talk with your partner, talk with your friends, talk with your family. We understand that not everybody has like wildly reliable or healthy support system. Yeah. So if that is you, those are some of the resources that you can reach out to. Postpartum Support International, on their website, they have free online support groups. You do have to register online, but the thing that I love about their support groups is that they have different specialized for groups for different women. So like a group for NICU mamas, a group for non-birthing partners. They have like a group for ADHD mamas, medically complex mamas. They have all these different groups to try and support women like based on what their needs are. And so that's a great resource. Locally, we also have some free support groups. Milkworks has some free support groups. And then Lean In is another free support group that I refer a lot of mamas through UNMC and reaching out for support. And then we also want to consider talking to your healthcare provider or looking into therapy. So I never care where women start the conversation, just start
Absolutely.
it. So your OBGYN might be a great place, your primary care provider, but also I tell a lot of listeners to look at their pediatrician. We're going to the pediatrician like 2 days post, labor and delivery.
Yep.
And now a lot of pediatricians are screening for perinatal mood disorders in moms. A lot of them aren't, but our doctors know that a well mama is a well baby. So you can tell that pediatrician, even though you're there for your new baby, I'm not quite feeling like myself. I'm wondering, do you have any resources for me? You don't have to go all into it. Just that alone and asking for the help is enough. A lot of them have a resource, like a printout that they can give you of well-vetted clinicians that are trained in perinatal mental health. If you Postpartum Support International also has a directory, if you are looking on your own, of therapists that are trained in perinatal mental health. I really do always recommend that you seek out a therapist that's trained in perinatal mental health, just because they're going to have the most up-to-date knowledge, resources, and skills on how to effectively manage perinatal mood disorders. And then you may want to consider medications. In some cases, medication is recommended.
Yeah.
I know that we often have moms that are worried about like breastfeeding and medication. Do you want to speak to that?
Yeah, I think, on that Postpartum Support International, they also have providers who have completed a perinatal mental health certification and really have extended knowledge in medications that are safe during pregnancy, postpartum, breastfeeding. I work with Her Story here in Omaha. They have resources available and a lot of knowledge and education in the perinatal mental health.
So if I'm meeting with a mom and I think that medication might be helpful, we have that conversation. It's always your choice, but then I'm going to refer you training in reproductive or perinatal. The other thing is just recognizing the symptoms like we're talking about today. So if you are pregnant or postpartum, continuing to learn and recognize what are the symptoms, pay attention to how you're feeling, whether those feelings are keeping you from engaging in things that you want to be doing or being present with, and knowing that if it's been after that 2-week period and it's not getting any better or it's intensifying, that's when I say, let's reach out for some support.
Yep.
Yeah. Okay. Well, Rachel, do you have as we wrap up today, any last thoughts, additional words of wisdom that you want to share?
I could go on and on. I feel like it went so fast and we barely got to touch on anything. And so, but I loved being here. Thank you for having me.
I really want to thank you just for sharing your wisdom and your guidance. If people are interested in learning more about the work that you do or want to be a client of yours, how can they find you?
Through your social media would be wonderful.
Yeah. And then
I am on Psychology Today.
Yeah.
Psychologytoday.com. I'm not really big on social media, but Jessie is a wonderful resource and lets me know anything.
Get you connected.
Yep, yes. She keeps me connected.
Yes. So thank you, so much for being here. I know that those that work with you are so lucky to have you committed to them and on their team and always having their back. And I know that the information that you shared today will be so helpful to so many. So thank you. I really appreciate you. And to our listeners that are joining us on Omaha Mom Talks, thank you so much for joining us. I want to remind moms that taking care of your mental health is just as important as taking care of your physical health, and that if you are struggling, you don't have to struggle alone. Reach out for some help. You deserve it. Omaha Mom Talks. Real moms, authentic conversations, no filter needed.